Melissa Burrows, cardiologist at the Hypertrophic Cardiomyopathy Center of Excellence at WellStar Center for Cardiovascular Care. I'm joined by Miss White, who is an HCMA Health Equity Committee health advocate, and she will talk to us a little bit about her journey through hypertrophic cardiomyopathy. Thank you, Miss White, for joining us. How are you?
I'm great, Dr. Burrows. How are you today?
I'm doing well. Well, Miss White, I appreciate you joining us today. And can you describe for me your journey with HCM or hypertrophic cardiomyopathy after you received the diagnosis, and then how, it was initially presented with a murmur in 2001?
So I was presented with a murmur in 2001. At that time, the doctors didn't think there was much of a concern. I had the echocardiogram done, and pretty much they said that there was no problem that they could see. So then I went along for quite a few years. The symptoms gradually worsened. So it wasn't like an overnight worsening. It just gradually got worse and worse to the point where I was having difficulty even walking one block or going up the stairs. So I said, now there's a problem. So that's when I started my journey trying to find out what was wrong with me. And I actually found a cardiologist who he was able to get me into testing. I had the echo, I had a cardiac cath, I had the TED, and then I had the cardiac MRI. And that's when it was presented to me that I had obstructive hypertrophic cardiomyopathy.
And I'm just curious to know, what was your initial thought when they told you the diagnosis?
First thing, I didn't know what it was. Never heard that before in my life. So then, and the first thing the doctor actually said was, it's a genetic mutation. So then I'm like thinking, I've had this genetic condition all my life, and it's just now actually that I'm feeling the effects of it. So that was, very, confusing to me.
Definitely. And then you had some big decisions you had to make. One was surgery, and the other was implanting a defibrillator, or ICD. Tell me a little bit about that and what went into that decision.
When I was first diagnosed and started going to a center of excellence, and the ICD was presented to me then. And it was also new. I was still getting used to knowing that I had this condition, and then now being presented with the implantable device. And I did my, research on it, and I said, I wasn't quite sure if it was for me, even though the doctors, suggested it. I wasn't ready mentally for it yet. So I actually did not get the device right away when they suggested it to me. And then still I was having the worsening symptoms, and just, it was really affecting my daily life. So the next thing they presented to me was surgery. And I said, well, I'm ready for that, because I can't see myself struggling like this for, another year through this. I don't think I would make it. And I live in Florida, so the humidity is another factor.
All right. And then when you think back of those initial period of the diagnosis and the big decisions for treatment, what could have been done differently? What might have been more effective in getting you treated maybe a little sooner?
I think the big thing was actually catching what I had, because I did have testing, but no one seems to have diagnosed it in the beginning. So I would love for maybe more doctors or more practitioners to be able to recognize it earlier. And because in the beginning, when I was told my doctor I was having fatigue and, chest pain, shortness of breath, the first diagnosis they gave me was, you have anemia. And I'm anemic. Well, that was true. I did have the anemia, but maybe if they'd noticed that there was something else happening. The second cardiologist that I did see told me that I had a mitral valve regurgitation and never even, and I did the cardiac cath there as well, and did the echoes. So the main thing for me is if just recognizing the condition so we can get treatment earlier.
That's definitely a good point. And as a member of the HCMA Health Equity Committee, how do you think your experience with the HCM diagnosis and treatment reflect kind of broader issues of healthcare access and equity? I mean, it sounds like you were able to get care in a center of excellence, but just kind of reflect a little bit about everyone else who has HCM and how they might not have so much access.
That's a very good question because I noticed one of the reasons why I wanted to be a part of the committee is because of my personal experience. I did notice that some of the practitioners were a bit dismissive and did not communicate well with me. When I was getting some of the tests, nobody even talked to me about the significance of the test, the significance of the results, or anything like that. And I started wondering, is this everyone's experience? Is it is it gender based? Is it race based? What exactly is the problem here? And I think about in some other communities, if you don't have if you don't advocate for yourself and you don't educate yourself, you will never even know that an organization exists like the HCMA. You will never know about the centers of excellence. So I think it's very important that we have committees that look into the different, equities in healthcare.
Now, you've definitely given us a lot of insight. I appreciate your time. Thank you.
Thank you so much.